Welcome back. In this lecture, we're going to explore water, or sometimes known as the sea within us. How much water do you need? Well, if you remember back in school, what we all memorized was we need 8 8-ounce glasses of water per day. I want you to think about that for just a second. Are we all identical twins? Do we all have the same amount of muscle? Do we have the same amount of fat? And the answer is absolutely not. So although that might be a general public health recommendation, we are so unique when it comes to our fluid needs that that's not always going to be factually true. In some of us, 8 8-ounce glasses of water a day isn't going to touch our fluid needs. And for others, it's going to overestimate our fluid needs. So I'm going to give you an example. I was working with a professional football player, and through our series of discussions, he was really struggling with some performance issues on the field. And it wasn't his talent and it wasn't his coaching. I live in Houston, Texas. It was the heat and humidity. His actual calculated fluid needs after a game or after a practice to get him rehydrated were up to 240 ounces of fluid. So if he just drank that 8 8-ounce glasses of water per day, he is significantly dehydrated. In fact, I would argue he would be the one person who would end up in the emergency room for a heat-related illness. So I think the challenge when we look at hydration is, again, because water is around us, water is everywhere, we drink, we eat water in our foods, sometimes we underestimate the value of this in clinical nutrition. We'll start out by thinking our bodies are 65 to 70% water, plus or minus. It is less if you have more body fat. Now, body fat is what is known as anhydrous. It really has very little stored water. Maybe less than 10% of a pound of body fat is going to be water. Not so with muscle. Muscle can be 70% water. That's the general estimation is 70% water. And think about this, the typical American, as we age, what do? We gain body fat and lose muscle throughout adulthood, and that changes the amount of body water. And you think, well, that's not a significant issue. Well, it can be if you become a hospitalized patient. It can be if someone is trying to calculate intravenous fluid requirements for you, if you needed an IV for fluid restoration. So this changing body composition really does have some implications. Now, this is not part of normal aging. Keep in mind, it is not part of normal aging to have that shift in body composition, and I will remind you, it can be prevented by resistance or strength training. But what's the function of water? What does water do for us clinically? And this is beyond our thirst. Certainly if you're thirsty, it's going to refresh you, but we're really talking about internal functions. Well, it serves as a transport vehicle for digestion and the transport of nutrients to the cells within the blood. Now, certainly maintaining this adequate blood volume enhances nutrient delivery. Maintaining adequate blood volume really makes us feel healthy and well. So I'll give you an example here. Have you ever gone from a sitting to a standing position quickly? You stand up, jump out of your chair, and all of a sudden you get a little lightheaded and dizzy. You kind of feel like you're going to fade to gray. You don't have enough blood volume. You're not delivering enough carbohydrate to your central nervous system, and your brain kind of goes into a holding mold. So we've all had that experience, but this is a great example of water serving as a transport vehicle. Mechanical functions. It lubricates joints. So the synovial fluid that I have in my knees, plus or minus, the synovial fluid that I have in my knees can help to lubricate my joints. It can also, for example, give me the mechanical function in tears. If I have tears in my eyes, the function of tears is to clear out, to remove for me any debris or dirt that I might have in my eyes. For most of us, however, a major function is to dissipate, get rid of, and regulate heat loss. Again, keep in mind that water becomes a really good medium for holding and getting rid of heat. Well, how does our body store water? Where do we store water? Well, certainly the majority of this is going to be around the cells and in the bloodstream. Certainly nutritional factors and the state of your health can influence where your body water is located. So for example, if indeed I have low protein in my blood, some of the fluid, some of that water seeps out of my blood vessels and actually goes into the tissues. Sometimes an example would be edema that you might have with congestive heart failure, that you're unable to move that body water and it leaks into the tissues. Keep in mind, and I'm going to remind you of this more than once, this is going to change your scale weight. Hydration, either overhydration in the example of edema, overhydration and dehydration are going to change what happens to you when you step on the scale. And in this case of edema, the water gets stuck in the tissues. It's stuck there and it cannot be urinated out. So the challenge is to not end up having that water in a place that it doesn't belong. And keep in mind, if we're 60 to 75% water, any changes in our water balance is going to make a difference on the scale. As we reflect back, keep in mind that any dietary supplement that causes a change in your body water, i.e. dehydration, causes you to eliminate some of that water from your blood supply, can actually affect your scale weight. Now, the average adult will eliminate somewhere in the range of 2.5 liters or about 84 ounces of water a day. About 1.5 of those liters comes through urine, and the rest is sweating, breathing, bowel movements. However, depending on your level of physical activity, the amount that you eliminate through sweat could be significant. If you run, if you do anything aerobic, you breathe in and out more times per minute, and the amount of fluid that you lose is greater. Now, we don't think of our breath as being a source of fluid loss, but actually our breath is 100% humidified. It's got a lot of water in it, and anytime I breathe in and out more often, I'm going to increase my body water loss. If you've had a fever, your heart rate goes up, your body temperature goes up, and your respiration rate goes up. And so the amount of fluid that you would lose is going to increase based on your state of wellness. Certainly, if you've ever had diarrhea, you can lose a significant amount of fluid by an increase in bowel movements as well as an increase in the amount of water in the bowel movements. Insensible losses are considered fluid losses through the skin, and again, sweat is going to be an example of that. Now, most of us don't think about our food consumption as a source of fluid. But the food that we consume, again, plus or minus depending on your food choices, is about equivalent to 17 ounces or 1/2 liter per day. So in each day, drinking 2 liters of fluid or about 8 cups would keep most people hydrated, and that's where that comes from. But food as fluid. Now, what are high water volume foods? Well, fruits and vegetables, 80 to 90% water, milk and yogurt, 80 to 90% water, and so all of those can make a difference. In my individuals who really struggle with hydration, they just can't drink any more voluntary fluid because their losses are so significant. Oftentimes, food becomes the magic bullet. So I describe high water volume foods, fruits, vegetables, milk, yogurt, and even soup, as fluid that you can chew, particularly in the cases of fruits and vegetables. So it oftentimes is that tipping point between optimal hydration for some individuals and dehydration. Certainly many factors influence fluid balance. Heat. Now again, I live in Houston, Texas, where in the summertime it's 95 degrees and 95% humidity. So in this case, my body's going to produce more sweat to cool me off. But the really bad news is when the humidity is that high, the sweat doesn't evaporate. And in order to cool you, sweat has to dry off of your skin. So depending on the part of the country that you live in, if you live in an area that has a relative humidity that is low, this may not be an issue for you. In fact, you might actually see on your skin, when you sweat, you might actually see salt crystals on your skin. You may actually be able to feel it on your skin as something that's a little bit gritty. That's not the case in an area with high relative humidity. So again, in Houston, I sweat more. I'm not really cooling myself off because what's happening? I'm not able to evaporate that sweat loss, and so my body has only one response, and that is to produce more sweat. It's not sensing that the sweat that's being produced is an effective cooling agent, or another way of thinking about it, it's not effective in dissipating that heat, so it's going to produce more and more sweat. Now, certainly in a cold environment, if you live in a cold environment, oftentimes the humidity in your home is relatively low. You can sense it by your skin gets very dry, your lips get very dry, your mouth dries off out pretty quickly. And you might not think, oh, I need to drink as much because you don't have that sensation of dehydration. So I think the challenge is that you don't look at the cold as a dehydrating event, and it actually can be. You just don't have the environmental trigger. You can't feel sweat on your skin, but it doesn't mean that you're not losing moisture through your skin in a different way. One of my favorite examples is what happens when you travel on a plane. Airplane travel can really contribute to excess fluid loss. As I rehydrate myself. Your breath is humidified, as I said, at 100%. And so you get on a plane and it's essentially 0% humidity in a pressurized cabin. You're not sweating or exercising, but just that act of breathing can really increase the amount of fluid losses that you have. So if you do international travel, that's one of the reasons why the flight attendants will always tell you, do yourself a favor. Make sure that you drink more. They'll offer you water more often. You're not exercising. You don't feel any sweat on your skin, but that fluid loss that's coming in your breath is really pretty significant. Some reports will suggest when the plane actually lands that the relative humidity in the cabin is about 40%, and that's all being put into that air by your breath. So how do we test our hydration level? If we want to be better educated consumers and we realize 8 8-ounce glasses of water a day may not cover everyone's needs, how can you as an individual know whether or not you're hydrated? Well, we already established that a significant amount of fluid comes out in your urine, and so your urine color can give you an idea of whether you're hydrated or not. Now, I really like looking at first morning urine, not necessarily urine throughout the rest of the day, which I'll explain in a minute. When I get up first thing in the morning, my urine should look like pale lemonade. If it looks like pale lemonade, I did a good enough job the day before of hydrating myself, because there should be some waste products from metabolism overnight, so it shouldn't be water in, water out in the morning. It shouldn't look like water, but it should look like pale lemonade. However, if I get up in the morning and it looks like apple juice, or I produce a small volume of urine, then in reality, I didn't do a great enough job drinking the night before. Now, a question that I always get when we're assessing that first morning urine is, what happens if I get up in the middle of the night 2 or 3 times to go to the bathroom? Well, this may not be as sensitive of a measure for you, but keep in mind, if you, throughout the night, if you see anything that is dark and concentrated, the color of apple juice, then reality, you didn't do a good enough job drinking the day before. Now, certainly in the professional athletes that I work with their fluid losses being so high, they've joked with me in the past, is there something more concentrated than apple juice? Do we have motor oil, for example, as a color of urine? And the answer is no. If that's the case, we probably need to get you to the emergency room. But what about thirst as a measure of hydration? I have to tell you, there's a lag between the time you get dehydrated and the time you actually experience thirst. So the old adage of, if you're thirsty, you're already dry, you're already dehydrated, is probably true. It probably has some validity to it. The other challenge is, the older we get, the less sensitive this thirst mechanism is. So say, for example, you're going to visit a relative in a nursing home, and you may be visiting and they'll describe that the only thing they had to drink all day long was a cup of tea. It doesn't mean that that's all they needed was a cup of tea. It's just that they never felt that mechanism. Certainly other things can complicate the thirst mechanism as well. If I'm on pain medication, say for example I've had dental work done or I had my hip replaced, if I'm on pain medication, that oftentimes is going to blunt my sensation of thirst, and I may not experience that. Again, if you have someone in a hospital who's on intravenous nutrition or on an IV, it doesn't mean that they still don't need some voluntary water if they're allowed to drink, but their thirst mechanism can be complicated by their treatment or their medication. The other thing that can complicate thirst is this intentional dehydration that comes along with some medication. If you're on a diuretic, for example, you may experience thirst because your physician is trying to clear excess body water out, and thirst may be a consequence. It may be an intended consequence of the medication that you're on. But what about hydration and exercise? What about how much fluid you need when you exercise? How can you measure your own hydration level during physical activity? Well, what you got to do, and we all don't like doing it, is you got to get on the scale. You have to get on the scale, because remember, a scale it can only tell you how much you weigh. It cannot tell you your percent body fat. It can't tell you how much lean you have, and it can't tell you anything other than, are you hydrated? So if I go out and run a mile in Houston, Texas, and I come in and I've lost 4 pounds, there is no way, the energy equation won't allow it, there is no way I lost 4 pounds of body fat. That's the bad news. More bad news is what I've done is I've measured my body water loss. So a 1 to 2% decrease in your body weight is going to affect your performance. So let's say, for example, you're a marathoner, you love to run, and you lose as little as 1 to 2% of your body weight during physical activity. That is enough to decrease your performance. And to me, this is an impressive statistic. Decrease your performance by 15 to 20%. So when athletes and people who are, compete in any way, shape, or form want to have a performance booster, I will describe water, hydration, as a legal, ergogenic, or sports-enhancing aid. We oftentimes overlook the simple and we go to the complex. We look for other things that are going to improve our performance, and certainly we've all seen in the media athletes who will use things that are illegal to try and get a performance edge, and oftentimes what they've done is skipped over the value of hydration. So keep in mind, in the case of activity, the scale is actually your best friend, because you can weigh yourself and calculate a 1 to 2% body weight loss. Now, the American College of Sports Medicine gives us guidelines on what to drink. What should we drink when we're exercising? Well, if your exercise is less than an hour, moderate intensity, when you're exercising, water is just fine. Nothing wrong with water. In fact, water probably would be your preferred beverage. But the rules change if your activity is intense or you're exercising in the heat for an hour or more. And I will tell you, I've modified the ACSM guidelines for my environmental conditions in Houston, and I'll say if you're outside exercising in the heat for more than 30 minutes, you probably need to switch to a sports drink. Sports drinks are intended to be used during physical activity. Sports drinks are not a lunchtime beverage. It's not something you should have at lunch. It is a sports drink, i.e. you drink it during sport. What does it do? One, it provides fluid. And the science is pretty clear. When a beverage is flavored, we tend to drink more of it than when it's unflavored. The other value here is that what it's doing is providing the electrolytes, and in this case, particularly the sodium that is lost in sweat. So think about this for a second. If you're outside exercising and you're sweating, what does your sweat taste like? We've all had that experience. Sweat tastes salty. So the major electrolyte that's being lost in sweat is sodium. But if you ask the average consumer of what do I need to eat more of or drink more of when I'm outside exercising, everybody talks about potassium. The potassium losses in your sweat are really insignificant. So I remember a couple years ago, and I won't mention the teams, a Super Bowl champion had bananas all over their bench. The bananas were out there to provide hopefully some fluid, but predominantly some potassium. That's not going to alter the amount of sodium that you lost in your sweat. So I want you to keep in mind that when someone's outside sweating intensely in the heat and develops cramps, and they start to cramp, your hand seize up, you can sometimes feel it in the arches of your feet. The challenge is you're not losing potassium in the sweat. What's causing the cramping is the loss of sodium in your sweat. So my solution to that Super Bowl champion was sure provide the bananas, great source of nutrition, but give them a salt shaker as well. They need to be able to replace the salt that's lost in the sweat. So the reason the sports drink is advantageous, it provides a source of calories, it provides fluid, and it provides the sodium that is being lost. Now, how else can I know my fluid needs? We now established what I need to drink. The other thing that you can do, again, is calculate your own sweat rate. What is a sweat rate? The sweat rate is how many pounds do I lose in that physical activity. So we've already talked about percentages, and now I'm going to switch you to pounds because that's actually an easier way when you actually get on the scale and weigh yourself. So if I get on the scale, for each pound I lose after physical activity, I've lost an additional 16 ounces of sweat. Okay, so think about your water bottle. For every pound you lose in physical activity, you lose 16 ounces of sweat. I'm going to tell you that's significant. To rehydrate, the science is also pretty clear. You need anywhere between 16 and 24 ounces of extra fluid. Now, why do I need that additional extra fluid? Why can't I just replace 16 ounces of sweat with 16 ounces of water? Because some of that water is going to be lost in urine, and what we're trying to do is rehydrate the muscle. We are trying to rehydrate that muscle. And so the challenge is, say for example, I have a football player who loses 10 pounds in a morning practice. Well, let's do the math here. He loses 10 pounds. How much sweat did he lose? 10 times 16 is 160 ounces of fluid. More than a gallon of sweat. So if I reflect back and think our general recommendations are 8 8-ounce glasses of water, this is going to be an example of an athlete that if I only gave him that, he's going to become significantly dehydrated. So what are our signs and symptoms of hydration imbalances? How do we start out by looking at this? Well, we can either be dehydrated or we can be overhydrated. Dehydration is characterized by weight loss, which we've established, confusion, a dry skin that's hot to the touch, and possibly an elevated core body temperature. I tell you what, most of us are not going to measure core body temperature because it's a rectal thermometer that's being used. But the challenge is in many athletes who have died of heat-related illnesses, you'll hear things in the media that say their core body temperature at the time of their death was 106. There was a woman who died hiking in the mountains out in California, and her core body temperature at the time of her death was 110 degrees, incompatible with life. So core body temperature would be more of a medical evaluation. In a hot climate, dehydration can be dangerous and result in thermal injury, a heat-related injury, because the core body temperature is not properly regulated. Why? If I become dehydrated, one of the functions of water is to dissipate heat. It's to get rid of that heat. If I dry myself out, I have no more water to dissipate the heat. And so things such as heat exhaustion or heat stroke are really pretty significant. This oftentimes comes, for example, in maybe 20 years ago, we would have coaches who would try and toughen up their athletes by not allowing them to take water breaks. Well, they're not toughening up that athlete, they're actually increasing the likelihood of a heat-related injury. So there are recommendations that athletes should get breaks, particularly adolescents, should get breaks maybe every 10 to 15 minutes for a fluid break. Not always practical during a game, but certainly during practice. Individuals who are acclimating to a different environment are more prone to dehydration when exercising outside. So if I come from the Baltimore Ravens to the Houston Texans, I'm going to struggle that first a week or so being outside because I'm not acclimated. And the science will say it takes anywhere between 10 and 14 days to be acclimated to a new environment. But you've got to acclimate outside. It doesn't mean that you just go to somebody else's house and sit inside. You actually have to be outside doing the activity. Other causes of dehydration can certainly be excess diarrhea, vomiting due to GI dysfunction, kidney disease, diuretic medications. And the best way to treat dehydration, if it's not significant, is obviously can we give it to you by mouth or orally. If it is significant dehydration, you can see an IV fluid replacement. And certainly many professional athletes sweat so much that during halftime they actually come in and are hooked up to IVs because there's no way the gut can handle all that extra fluid. How much fluid could you handle? How much water could your gut handle at a time? And I'm going to suggest to you it's about 1 liter to 2 liters. And so if I've lost maybe 1 to 2 quarts in my sweat, there's no way I'm going to be able to replace all that with just oral rehydration. Now, what about overhydrating? Is overhydrating an issue? And I'm going to tell you it is. Overhydrating means that you drink more water than you could possibly need. Okay? There have been examples on college campuses, for example, where fraternities cannot haze with alcohol. They pretty much lose their charter. So what they've done is they've hazed with water. And they make their new inductees drink and drink and drink and drink. What ends up happening here is you drink so much fluid, that you're actually diluting the amount of sodium in your blood. Now keep in mind, sodium and potassium are essential electrolytes. Your body works really hard to try and keep those two things in balance. Well, when I drink water, and water really has very low sodium, when I drink water, I dilute the sodium level in my blood to a point where I can actually have cerebral edema, swelling of the brain, and it leads to death. So there have been some fraternities in the news that have gotten actually in significant trouble by promoting this hazing with water. But it also happens to people who are physically active. Where it usually happens is in people who are new runners, they're new marathoners. They've heard from people like me, don't get dehydrated, it impacts your performance, calculate your sweat rate, check your urine color. But what happens when I don't do any of those things? And I decide I'm just going to go out and run and drink. I don't want to get on the scale. I'm not checking my urine color. Say, for example, I go and run the Houston Marathon. I start out at 120 pounds, and I come in from the marathon course and I've gained 2 pounds. What that means is I drank more fluid than I lost in sweat, and I'm more likely to become hyponatremic. And that's the medical term for inadequate amounts of sodium in the blood. Inadequate amounts of sodium in the blood is defined as hyponatremia. So the runner comes off the course, they're a little confused, they're a little lightheaded, and initially the medical folks are going to look at that and say, okay, you're dehydrated. But what we do in the Houston Marathon is we weigh people at the beginning of the marathon and we weigh them at the end. And actually we have their weight recorded in their little timing chip that goes in their shoe. So if you're not familiar, that's one of the ways that they pace during a marathon is they have a timing chip that they can tie into their shoe. We record their starting weight. So if somebody comes in off the course and they've gained weight, they're confused, so they might not be able to tell us what their normal weight is. They're confused. And so we want to make sure that we're actually not treating them inappropriately. So in someone who runs a marathon, they should lose a little bit of weight. They just ran 26.2 miles. They've burned calories. They've burned energy. And remember from a previous lecture, for every mile you run, you burn 100 calories. So within a marathon, you burn about 2,600 calories. So we do a really good job of monitoring levels of dehydration and overhydration. It is a medical emergency when someone is hyponatremic or has gained or overdrunk. Because again, the brain is going to swell, and of the individuals who oftentimes die from marathoning, it's more likely to die from dehydration, but overhydration can be an issue as well. So the best way to prevent hyponatremia is to know your sweat rate, to weigh yourself before and after. Now, what about some of the other common things that affect hydration status? What about things such as caffeine and alcohol? Well, certainly caffeine, if you're used to drinking coffee, if you're used to drinking tea, you have acclimated to that level of caffeine and you really don't lose a significant amount of fluid. I will tell you, however, with energy drinks that have maybe 3 to 4 times the amount of caffeine that's found in coffee and tea, there really can be a dehydrating effect of caffeine from energy drinks. What about alcohol? Alcohol stimulates your body to produce more urine, so drinking excessive amounts of alcohol can also cause dehydration. Medications and disease states can cause intentional or accidental dehydration. Certainly diuretics can promote that body water loss. Laxatives can promote body water loss. Congestive heart failure, it is intentional that the physician is giving you a diuretic to reduce body water. So in individuals who have congestive heart failure, weighing yourself every single day really is an important strategy. If you lose a significant amount of weight, you might be dehydrated. That might be the intent of the medication. Or if you're gaining weight on diuretic therapy, your physician may actually have to change your medication or adjust your dose. So again, some frequently asked questions. What are these energy drinks? I've already established there are a significant amount of caffeine in energy drinks. There are also B vitamins, and there's also amino acids. We don't really know the long-term consequences of energy drinks. Now, when we talk about coffee and tea actually have nutrition in them. There are great phytochemicals, there are great antioxidants in coffee and tea. So because those are whole food and the caffeine is wrapped in whole food, it behaves differently than the caffeine in an energy drink. So in summary, those energy drinks are going to behave differently than coffee and tea. Always look for a whole food source of caffeine versus a man-made source of a caffeinated beverage. Thank you very much.